Hi guys, good morning. It's Sunday morning. I think I'm losing some time. So much is happening in our country now. Yes. Let me just get it correct. It is Sunday the 15th of March 2020. I was just looking at no, I don't think you can see it. It's not in the shot. Anyway, I was looking at the calendar behind me just to get the date right and so on. The last time I did a live, well, not a live, I don't know why I'm calling this a live, but the last time I posted on this vlog, I was talking about what was happening in our country and the fact that I was very emotional over the fact that our children, got caught somewhat in the crossfire with all the drama that they had up on the East Coast there, which unfortunately one person was killed. But I'm not here to talk about that today. So much has happened in our country since then. Every time I think Guyana can't get to a point where we break our own record, I'm proven wrong. Yes, we still have not officially, we still not, well, not officially, not at all. We still have not sworn in a new president because there's been so much back and forth. And those of you in the diaspora, especially though, I know some of you follow me to get a gist of what is happening in Guyana, but I know you also follow the mainstream news media. They're on every day, so you've been getting an idea of all that confusion. I'm not here to talk about that today. As I tell you, because of my job, even though I've taken a step away. Some people still like to call it a break. That people like to say, oh, Malika, you're not completely done with politics. I try to stay away from discussing the actual politics of itself too much, again, because of the job that I do and the entity that I represent in terms of being a public relations officer there. What I'm here to talk about today is we have a new challenge. A few days ago, the country recorded its first imported, and it's very important to stress, imported case of the COVID-19, the coronavirus, as everyone knows it, COVID-19. A few days ago, we recorded here in Guyana. It was reported. Let me go with the reports. It was reported a confirmed case. That's a few days ago. As of last night, unfortunately, the first case, the woman passed away, and it was not discovered until after she died that is what she had. Unfortunately, the numbers have risen to 4. This is of us last night. So what I'm telling you is of us last night. So those of you who might be watching this video after the 15th, I don't know what is going to happen. All right? So, and so far it seems that it's her household. The other 4 persons came from the house in which she was living in. Again, full disclaimer, I am no doctor. We all know this. I always tell you. So anything that I'm telling you is going based on some of the things that I would have read on WHO and so on. And coming from our Ministry of Public Health. I'm not here to give you health advice, so to speak, but I thought it fit to talk about that for a while. A number of things happening. I find we have too many persons going into panic mode. Yes, it's a serious situation. People have died across the world, across the globe, hundreds, thousands. So I'm not trying to tell you to reduce how you feel about it, but what I'm trying to tell you today is do not panic. Pray a lot, drink a lot of water, and everything that I'm telling you is based on what we've gotten from the health officials. Aside from the pray, I am a Christian, I'm Catholic Christian, so I will always tell you to pray. I believe in God, and I believe that God answers prayers, and I have seen his works. And besides, this is also the Lenten season, so I will always tell you to pray. Don't expect anything else. For those of you who don't believe in God, I am not here to convert you. That is between you and God, or between you and whoever you believe in. But I'm telling you, when it comes to certain things, I will always tell you to first and foremost pray. In terms of what is coming from the health officials, we're hearing drink lots of water, stock up on your immune system, build it up. If you've been lacking on that, a lot of us, we don't focus on our immune system until we get a common cold or a common flu. But as you can see, based on the reports that we're getting and all the studies that would have been done so far, this is more than a common flu. All right, again, people have died. But there are some other things I want to address. While you're doing all of that, don't panic. And remember, and I'm going to use something that a colleague said a few days ago. We had a meeting to address the virus and how we were going to deal with how the offices and so on are going to deal with it. She said something, please do not use corona as an excuse, COVID-19, because it's, it's here again, it's been imported. Do not use it as an excuse to be rude or to be selfish. Not every cough is corona, not every sneeze is corona. So I'm not saying don't protect yourself, but there's smart ways in which these things can be done. Try not to make people feel bad or too isolated. You realize somebody got a cough or a sneeze or a cold, I would do it. You realize somebody has a cough or a sneeze or a cold, try to stay away. They said 3 feet, right? Ensure that they don't. And for people who are sick, understand the sensitivity of it now. You may not have coronavirus, you may not even have a cold, you may have a simple dry cough, but the minute you cough, everybody like, oh my God. All of a sudden people become. So you of yourself also got to condition your mind. It is not personal. Do not take it personal. And for those of you who are genuinely sick, again, it may not be corona. It may be a common cold. It may be a common flu. In Guyana, we get that. Some people get flus 2 and 3 times a year. So for us, the coughing and the sneezing is a norm. For those of you who have that, understand that because it is sensitive now and because we're dealing with COVID-19, if you know you're sick, isolate yourself. Again, I'm not talking about if you have COVID-19, if you have that virus. I'm not talking about that. That needs special attention and needs public health. You need to call the hotline number and get them to come to you. I'm talking about if you have a common cold or the common flu, you know that is what you have. You've been checked out. Still, understand that people out there are fearful. Even though I'm telling people not to panic, people still will panic because this is not something that we've been dealing with previously. We have seen the report, the international news and so on. We've seen that people died from it. So understand the fear. As much as I'm urging people, try not to be fearful and panicky. Those of us who are not fearful and panicky, have patience with them. Understand the fear, because as much as I'm telling you all this, if somebody comes next to me and I realize they're sneezing and they're coughing, yes, I may not react irrationally, like move from next to me or try to, but I'm going to find a way to protect myself and probably try to remove from that person. Some of us live in households where it's more than one of us. It's 2, it's 3, it's 4. We have to take that into consideration. You might be careful at work or wherever, but then, and I'm not beating up on men here, guys who are watching this, but sometimes you guys are a little more carefree than women. You can come in, you can throw your bag there or your keys there or whatever, and you don't know what germs you're spreading around. All right, I'm not saying that you're doing it intentionally, but I'm just saying that sometimes men are a bit more, you're a bit more carefree than women. So if we get a little edgy or antsy, bear with us. Understand that people are scared. I also, but let me take a pause before I talk about something else relating to the same issue. I noticed the Ministry of the Presidency and the permanent secretary, they have sent out a notice, and this is for those of us living in Guyana. Your staff member, your managers and so on, and heads of departments will talk to you eventually. But I want to congratulate Guyana's Ministry of Public Health and all the entities, public offices, public service offices working to protect their people. They sent out a notice saying that because of the COVID-19 virus, I'm just pressing it here, this is not word for word, they're basically asking that, for want of a better term, the working hours be staggered. Some people, will rotate. Some will work one day, the others will work the other day, every other day, or if some people may choose to do it half day. Some may work half morning shift, others may work half day shift. And this is, I know, this is to begin on the 16th of March, which is tomorrow, Monday, 16th of March, and it's expected to run until the 27th of March. That's the Friday. I think after that, then a review process will be done to see where we're at, and providing, hopefully, we keep the COVID-19 virus under control. So I want to congratulate them. They're doing a lot to sensitize the public. They're reminding you how to wash your hands and all that. And these are things we learned as children, but as we become adults, life gets so demanding. We turn to this and that. Sometimes you come off the road, you go right when you start cooking, and you haven't washed your hands properly. So I'd like to congratulate them and thank them. But remember, individuals, the onus is still on you to take the necessary precautions. We don't know where the germs are. You can't see it. You can't see the virus. So, and I want to urge people too. I want to take this opportunity. People, don't be selfish. If you know, that you're sick, you've been diagnosed with this thing, whatever you have to do on the road, it can wait. Stay at home. Whatever measures they put in place for you, whether it's isolation while they're monitoring you or quarantining you, adhere to that, because it has it's reported that allegedly the woman, the first case that we discovered here where the woman died, it is being alleged that the husband, even though he was placed in isolation so that they can monitor all of them, he disobeyed the rules of it. Again, reports indicate that he went out. Come on, we can't be this selfish. When you do that, you are putting other innocent people at risk. When I say innocent, not that you've done something wrong. You didn't give yourself the virus, but people who don't even know it's a possibility that you have it. If it is that you've been discovered with this thing, do what the Ministry of Public Health and the doctors and the nurses and all the other health workers tell you to do. If they say that you must be isolated for 14 days, by Christ, please be isolated for 14 days. If it was quarantine, please ensure that whether it's at home or somewhere, a facility that they're putting you. I know quarantine is a little more heavier method than isolation. Quarantine, I don't know again if they will quarantine you in your homes or if they have a center. Eventually you will hear all these things, but my point is, if it is that it is discovered that you have this virus, please listen to them. 1, you're saving your life, your own life. That's 1. 2, you're saving the people around you. You cannot be so disobedient and own way and I know he's not the only person like that. There are a lot of us who don't. Let me say it plain. I don't like to have to deal with medical practitioners because of this fear. The first thing, I don't like to know that a simple cold ties me, a simple headache ties me up in knots, because I feel that I think the most important thing to human beings, I would want to believe, is our health. And it's like, if you don't have that, you don't have nothing. You can get anything else. So I always pray and ask God and thank God for health and strength. I think that is our most important thing. So the minute I have a slight cold or a headache, it ties me up in knots. Mentally, it does something up here. So I understand this fear. But understand also that if you don't do what the medical practitioners are asking you to do, you're putting yourself at further risk, because you're not doing what they're telling you to do. Then instead of getting better, you can deteriorate. And if you go out there, chances are you're going to cough, you're going to sneeze, fluid going to come from some part of your body. And the person out there that's walking by, unsuspecting, you're giving it to them. So we cannot be selfish people. We can't. I know you got things to do. This is a spokes in your wheel. But look at it. You're alive. You still, whatever it is, can wait. They isolate you. Stay in isolation. 14 days. Come on. We had elections since the 2nd of March. Today is the 15th. And we have not yet sworn in a president. You can't be hurried to do anything in this country at this point, especially when it comes to your health and strength. So stay the course, follow the rules, do what it is. And as I put my hand to my ear, one of the things that they're saying too, apart from washing your hands, try to keep your hands out of your face, your mouth, and so on. These are, I know none of us are perfect. We're all human beings. We're not going to get it right immediately, but we can try. We can make the effort. You're going to slip up. You can touch things on your hand and come party your face, but every time you remember, try. Try very hard, because you're saving yourself, you're saving your household, you are saving your community, you're possibly saving the country, all right? Because the important thing is to contain this thing, is to keep it tight and ensure that it does not spread. So by the time that the ministry and the hospital and the other medical practitioners and so on are ready to do a review, you know, we can see exactly where we're at. And people who are sick, remember they have hotline numbers. Remember they have those hotline numbers. Call them, let them come to you. And for the public hospitals, you know, because I don't want a lawsuit on my hands. It was mentioned in the news, but I'm just saying it. You cannot have a patient, treat them, suspect that this thing is COVID-19, and then just send them along. You can't do that. You simply cannot do that because you're putting your own staff members at risk. You know that right now it's only the Georgetown Public Hospital that is testing for COVID-19. This is a national response. You're private. Call and say, look, we got this patient. I don't know if so and so, but we're sending across. Could you advise us how to send? What should we do? Whatever to contain this thing if it is that. Don't just up people and send them and then you have to quarantine your own staff too. Or isolate your own staff. And again, as it goes, you don't know the contact, and it's easy. Clearly, I'm looking at this thing, and it really is a virus. I would say it's a virus from hell, because it's so. I don't even have the words for it. Again, I'm no medical practitioner, but it's as if it's a virus from hell. It's just like it's mutating and quickly. So I'm saying, please protect yourself and protect people around you. I'm going to wrap up this just in a bit. To those of you unconscionable, I just came back from church, so I'm trying to choose my words carefully. I don't even unscrupulous, disingenuous, selfish, and wretched people who are using this opportunity to hike your prices. Lysol, baby wipes, rubbing alcohol, methylated spirits, even vinegar. Because now they can move on to other things, because the initial cleaning products and disinfectants and so on, things that kill bacteria and things that would kill the coronavirus, you jacked up the prices. Some of you by more than half. Then there's some of you who don't. Your business is not in these items, but all of a sudden some of you go and clear the shelves because you're going to get them home and you're going to be selling them to make a buck. You people are evil. Understand that if people who genuinely need these things to clean can't get them and they get sick, possibility exists you to taking those things off the supermarket and hiking the prices up, you're going to get sick too. You think having all of them in your house is going to help you? No. It will not help you. And some of you need to understand, if you panic and you use too much of these cleaning agents, you're going to make yourself sick. Also, everything you do, you have to do it in moderation, and you have to do it smart, and you have to go by the guidelines that are coming from the Ministry of Public Health and all the other health practitioners. I'm saying, those of us who are always online, make the World Health Organization's page, their website, make it your best friend at this point. It's telling you everything that you need to do. Some of you are about Georgetown with face masks and gloves. Have you read the guidelines? Do you know that you could be making yourself sick? Read. I'm so worked up at this because I started to talk about the unscrupulous people who are doubling the prices on those things. What is wrong with you people? Some of you are at the pharmacies and so on in groups. Everybody hurrying to get everything off the shelf, and all of you in one place at one time in the same one space, clustered. Now all of you 30 something of you in one small space because everybody wanted the last bottle of Lysol. What do you think you're doing there? And in the cluster of you, 30 something of you or 50 something of you in one cluster trying to pull and grab, let one person in the crowd sneeze or cough. Then you can realize that really and truly you are being silly. I am not saying take this thing lightly. I am not saying that at all. We have to take it seriously. But be wise, people. Let us be wise. Let us be smart to save our environment and to save our country and to save our city. We have so much to live for, so much to look out for. And support each other. Somebody's sick or whatever, call them. Encourage each other. If you know it could be a common cold, a common flu, pick up the phone. So, Sally, I think you should call the hotline and let these people check you. You got this cold too long or whatever. Call, check up on each other. Even those of you who are going to airports and so on, if you have relatives coming in, let them get them. They might got no symptoms, check them. Check them. It's going to take nothing from you. I think when you call the hotline, they will ask you signs and symptoms and so on, and then they will decide if it warrants a testing or whatever. But please, people, let us help each other. Let us stop robbing each other blindly. I can't can't imagine sometimes, and I know this part of it is not Guyana alone, right? Because you're seeing the reports all over the globe, people running and pulling disinfectant off shelves, and the shelves are bare. What are you doing with all of it in your house? For those of you who are not selling, because I know some of you making a buck on the side, which is very bad, because you're charging double the price for these things, and people are so scared that they're willing to pay for it. Come on. That's just not right. That is not right, because again, you double the prices on these things that people can't afford and they get sick. It can pass on money. You're holding money. You're holding this. You're holding that. You don't know. Stop doing it. Stop it. Stop it now. We need to save our nation. We need to all protect ourselves. So I think that is all. And remember, not every sneeze or every cough is corona. Don't make people feel bad. Put yourself in other people's shoes. All right. So I'm going to wrap up this video for now. This session. I'm thinking if I have forgotten anything. Well, if I have, the next time I talk to you, hopefully the next time I talk to you, we would have sworn in a president in our country, and Guyana can just look forward to moving forward and going the distance and doing what we have to do. So until then, I'm going to tell you happy Sunday. Have a great week until I talk to you again. As always, don't only look at this video, comment. Please share your comments, please. And please, 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 I did say to you the last time, I had to delete a couple of people who got nasty. I had to block them. I don't mind doing that. So please keep your comments respectful. You don't have to like everything that I say. You don't have to agree with everything that I say. You can either stay silent or come and simply say you don't agree. Don't get nasty about it. All right. So thanks for always watching. Don't just watch. Like, share, comment, dislike, whatever you want. Just don't get disrespectful. And subscribe. Get your friends and family to subscribe. Message me, on YouTube, comment. For those of you who follow me on Facebook also, you can also message me there. Tell me things that maybe you'd like me to talk about, that you want to know about, providing it's not too deep into politics. Remember, I can't really discuss politics the way that I used to do, to protect the integrity of my job at this point. But again, thanks for always watching. Stay informed, be safe, protect yourselves, do what you got to do. We're living in serious times, and never ever forget to pray. Take care.